my assessment, there are five major bottlenecks that thwart our state's execution capacity. The first is hiring. We are unable to hire enough public officials, and despite the perception of a bloated bureaucracy, we in fact have a smaller percentage of officials per our population than in many other countries. For instance, there are numerous vacancies of police and doctors and other healthcare providers. Similarly, we are often unable to make sure that the ones we hire have the right skill sets and motivation, something that requires explicit competence mapping for all jobs. For instance, what are the competencies required for officials being hired for finance department versus say the Department of Textiles beyond just general administration skills? The second bottleneck is the lack of clarity that officers have over their roles and responsibilities. What exactly is my primary objective? What agency do I have? What authority do I have to make changes to make sure I achieve that outcome? An example here is a teacher. As a teacher, is my job to just make sure that I complete the syllabus or also to make sure that kids pass the exam by teaching to the test? Or actually, is it to make sure that students have learned the material and are ready for the next grade? And what freedom do I have? Not just as a teacher, but even as the headmaster or even as the district education officer to change the pedagogy, the syllabus, or the exam to make sure that these learning outcomes are being achieved and I'm not just teaching to the syllabus or to the test. The third bottleneck is that even if we hire the right people and make sure they understand their responsibilities and give them the agency to execute on it, uh, we still need to make sure they are getting appropriate training to execute on these roles and responsibilities. And unfortunately, many of our training programs do not answer three fundamental questions. The first question being, does my training address the skills needed to succeed? For instance, investigating and forensic skills for the investigating officers. These are IOs can often end up being constables, head constables, and assistant sub inspectors who arrive at crime scenes, and not just IPS or state police officers who are only involved in a tiny subset of crime investigations directly, but instead rely on these junior officials. And yet, many of these junior officials who are the first to arrive at the scene and the last to leave don't get the sort of training that they need. The second question that training needs to answer is that does my training happen when it is needed most, when it is the most salient? Once again, as in most countries in the world, the training for civil servants is much more focused at the entry point when we are hired into the civil service or hired into the police. But then, again, to take the examples, the constables, the head constables, the ASIs spend many years of their life initially on beat duty or security duty or rights prevention. And when they are actually posted as investigating officers, there is almost never a refresher training that is given to them. The final question that a training has to answer is that is the training provided in a format that aligns with a lifetime of learning and improvement, not just a one-time training? Online training and courses have massively increased in quality and can provide access to the best teachers worldwide in a way that you can all be learning in real time all the time. The fourth bottleneck is the lack of sufficient incentives and accountability to make sure good performance is rewarded and incompetence or dereliction is not tolerated. So, for instance, how are we making sure that healthcare workers are rewarded for improvements in health outcomes in the area? How are we making sure they're rewarded for even showing up at the primary health centers and showing up at the various clinics? And then how do we hold them accountable for stagnant public health outcomes? Is a really important and a huge challenge for the state. The final bottleneck that restricts states' capacity to deliver is that civil servants often do not have the tools they need to base their decisions and work on evidence and data rather than on their instincts, their inertia, or ideology. To be able to make decisions which are effective, this requires four key things. First, sound data collection. For instance, just sticking to the example of the healthcare providers, what is the actual immunization rate in my district? and not just one reported by frontline healthcare workers on paper registers without any verification. Instead, can we create a tablet based system with GPS tracking and scan barcodes for Aadhaar cards as well as the vaccine, as they are doing in Haryana? Is this data being gathered? The second part is it's not enough for this data to be gathered. You then have to invest in data analysis skills to verify the data, understand trends, and understand the extent of the problem. For instance, how many people are using dialysis? What happens to them once? What are their life outcomes? How many survive? How many die? Very little of this data is analyzed for that. The third part of this puzzle is to provide time and resources to government officials to design programs based on the best evidence from around the world, and then to rather than again just going with the mindset of the programs that existed before. For instance, we are living in this time of COVID. When the vaccine for COVID comes out, how will we make sure that the supply systems are there to get this vaccine in place? But more importantly, how will we make sure that the parents of the children, as well as the all the adults themselves, will use these vaccines and go and get themselves immunized? Can we use social networks? Can we use some sort of incentives for parents to spread the message and to increase the immunization rate? The final piece of the puzzle for the data is to make sure that you pilot and evaluate these programs, and ideally in partnership with leading independent researchers, before just scaling them up and turning them into these massive programs where the state then has to keep investing in these programs with very little positive outcome, thereby restricting the state's ability to influence the final outcome. So each of these five challenges that I laid out can sound daunting, but they are essential for a holistic plan for competence and responsibility mapping for each position. If you provide targeted lifelong learning, create accountable mechanisms, and finally create the space for data driven decision making, then you can overcome many of these bottlenecks that limit the state's execution capacity. Overworked and overextended government officials can definitely contribute to a reduced execution capacity of the state. But it is also important to understand that this may not be a universal problem, but especially one for frontline workers like ASHA or primary health center nurses, more than for some other parts of the government. But irrespective, I think there are three strategies can be useful for everyone to avoid this problem. First is extremely obvious, but still important to remember, that it's important to fill all the vacancies. One of the reasons for administrative burden on government servants is the staff shortage faced by government departments. India has one of the lowest rates of per capita public sector employment of any G20 country. For instance, India has about 1,600 government servants for every 100,000 or 1 lakh residents. In stark contrast, the US has close to 7,700 workers for every 1 lakh residents. So even though we have this sense that the Indian bureaucracy is huge, it is big in absolute numbers, but in terms of related to the population, it is much smaller, and clearly the workers are overextended. And the other feature of the Indian bureaucracy is that the majority of workers are in the lowest paid categories, which means much less skilled staff. So, what can we do about it? I think the first thing that is essential to do is to create time usage diaries for all positions, to understand the time taken for officials to execute on current responsibilities, especially for frontline workers. Many years ago, I worked in the state of Karnataka with the National Health Mission, along with Rima Hanna, my colleague at Harvard. And as part of that, we interviewed lots of doctors, nurses, and we just added up what were their responsibilities and time that they had to spend at the primary health center, at the PHC sub-centers, in field visits to the villages, on various campaigns like Pulse Polio, on school health visits, in administrative work in the primary health center, as well as meetings at district headquarters and other locations. And once you added up all these hours, it was literally twice the number of hours that people were expected to work. And so every time the government introduced a new health program, it added to their workload without taking anything. So once you have these time usage diaries, there are two things that need to happen. First, reprioritize for each position what their main goals should be and cut back on the other things that have gotten added over time. So that has to be the first thing. And then the second thing has to be that you must cut back some current activity every time you add something new to the to their plate. So every time the health department thinks about adding a program which it knows that the focus of that has to be on the ASHA worker, the health department should be responsible for accounting for how many extra hours a week is that going to take and cut back something equivalent in number of hours from her existing portfolio. Because if you're not doing that, you are just expecting every healthcare worker, every ASHA worker to be a superman or a superwoman, and and that's just unreasonable to do on a long-term sustained basis. But I also have hope. I think there are three tools that we have which can really now help in addition to cutting back their time. And these three are technology, training, and data. Let me explain what I mean by each one of them. In terms of technology, I think technologies like tablets or iPads or readers allows the health frontline workers to directly collect data. They can scan barcodes of things like attendant, the names of the children, or the vaccines which are given to the children, or the module that they are teaching, rather than forget about writing by hand, but even typing it in these things. Similarly, GPS in these devices can capture date and timestamps, and over time, over hundreds of and thousands of transactions, every 30 seconds, every 1 minute saved in this can actually aggregate to a very big time saving. The second thing is to provide training to workers on how to become better at their jobs. I think if you can have in economics, obviously we have the concept of productivity, and so you can either spend more time at the job, or you can do that job in a more productive fashion and save the amount of time. So, for instance, providing refresher trainings for police investigating officers can greatly reduce the amount of time that they spend in each investigation in simple tasks like fingerprinting or picking up samples from a crime scene. If you can make them more productive, then you can reduce the burden on them. And then the final thing which governments can do to help government officials, overextended government officials, is to provide them the data analysis that helps them save time. For instance, GST evasion is a big problem in India, and the task falls on these GST inspectors to go and raid and various premises to see which premises are genuine or not, whether they're doing the right thing or not. And literally they go down alphabetically to do 100% coverage because you don't know whom to raid or not. You can create simple machine learning AI tools to and train the machine to learn over time what are the characteristics of a business which flag that business for a close inspection, and thereby save the time of the GST inspector in going to the businesses which have the highest probability that they are evading the GST taxes, and thereby save the bureaucrat. So personally, I feel very hopeful that if the government has the will to create time usage diaries, to reprioritize these times, cut back on some of these responsibilities, and use technology, training, and data, then the problem of overextended government workers and the subsequent hit on states' capacity to deliver can be mitigated. Increasing state capacity is a huge challenge and priority for the government. It requires a holistic plan that includes better hiring based on competence and responsibility mapping for every position, providing lifelong learning, and creating space for data driven decision making. One other important piece is increasing accountability through better monitoring. If done well, it can not only help increase state capacity and lead to better delivery of services for the people, but also create greater equity within the government as the underperformers are held accountable. A few years ago, Professor Reenma Hanna of the Harvard Kennedy School and I teamed with the National Health Mission in Karnataka to design, pilot, and evaluate an innovative program to improve attendance of doctors and other healthcare providers in rural primary health centers in 5 districts of the state. The program used digital capture of fingerprints and their transmission in real time to the state headquarters as a way to reduce absenteeism. Based on the biometric attendance data, the government planned to issue both positive and negative incentives, that is, penalties, like deduction of earned leave for employees with unauthorized absence, as a way to hold the underperformers accountable for their absence. So, what was the result? The monitoring system increased attendance among nurses, lab technicians, and pharmacists, almost a 7 percentage point increase from a base of about 40%. But it had no effect at all on doctor attendance, which stayed at a baseline level of 36%, extremely low. And even this effect went away at a follow up which took place 2 years after the intervention. So, in essence, all the benefits of this program disappeared. But what is incredibly promising was that even this limited improvement in attendance of nurses led to improvements in antenatal care and infant health during those 2 years. So, what has been the insight from this and many other similar studies that we have been involved in over the last few years? First and foremost, it is not easy to create an effective accountability system. A good accountability system requires significant investment of time and effort by senior officials to design it to make sure everything is well thought of and adheres to rules, especially since it intersects with personnel rules and policies, and it also may require additional funding. For instance, in this case, this required funding for the machines, the monthly SIM cards, creating a system for repair and replacement, a data center in Bangalore to collect the data, and understanding how to issue show cause notices that show adherence to the required personnel principle of application of mind if they are machine generated. Second, it requires even more time and effort and capital to implement it well, and the technology alone is not the solution. But the devil, in fact, lies in the detail. For instance, in this particular case, it was not just enough to create a new program and issue orders to others to implement it. One has to make the time to keep listening, to receiving feedback from the field, constantly improve and changing the program to respond to the roadblocks that come, and then also to overcome the political and other opposition that comes with every accountability program. In this case, that included, for instance, changing the incentive system and using the political capital with the finance ministry to make sure funds for incentives were sanctioned in the budget and dispersed on time. Otherwise, the staff would just lose faith in the promise of the National Health Mission. The third and the final lesson is that if you do not get the design and implementation right, an accountability system can actually have unintended negative consequences. For instance, again in this case, once it became clear to the many of the health workers that the system was very difficult to implement, and there were transfers of senior officials who had put their political capital behind it, not only did the system fall into disuse, but in fact attendance went below what it was before the program due to the perverse demonstration effect of absenteeism not having any real consequences on the underperformers. In sum, governments can leverage growth in digitization to improve human resource management and accountability, but technological Innovation should be combined with changes in broader rules governing frontline workers and government employees, and long term financial and political commitment that empowers officials to act on any data that comes from a monitoring or accountability system. Absent that, this will be just a waste of time and resources. But most importantly, as I began, an accountability system can only be one part of a holistic strategy to improve state capacity, with lots of other important points like improved hiring, mapping of the competencies, as well as various other training and lifelong training mechanisms.